Okay, welcome back. In this video, we will cover chapter number 12, the cardiovascular system, transport and supply. A quick introduction to the system. The cardiovascular system is what will transport nutrients and oxygen to cells, and while taking waste such as carbon dioxide and other byproducts of metabolism away from the cells. Now, the main pump that circulates the transport of this blood is obviously the heart. Learning outcomes for this chapter: be able to identify structures and functions of the cardiovascular system, be able to trace the blood flow through the vessels and through the chambers of the heart, explain the coronary circulation, describe the contraction of the heart and the conduction system, be able to differentiate between arteries and veins and capillaries, list the major components of blood and their functions, be able to discuss the importance of blood typing, explain the process of blood clotting, explain the importance of blood pressure regulation, and lastly, be able to describe various cardiovascular diseases. Alright, system overview. The major components of the cardiovascular system include the heart, the blood, and all of the blood vessels. So it's not just the heart itself, it's the heart plus all the vessels together. All arteries will go away from the heart and will branch into smaller vessels called arterioles, and those will become capillaries, where you have the actual gas exchange at the capillary level. Those capillaries will travel on and become venules, really just small veins, and they will get larger and form veins. Now, most people, when they learn the information about the cardiovascular system, learn that arteries carry blood with oxygen and veins carry blood without oxygen, which is true except for one major exception: the pulmonary vessels. So instead of worrying about what kind of blood is being carried, focus on the direction of the blood. All arteries, without exception, carry blood away from the heart, so pulmonary arteries included. All veins go back to the heart, without exception. Now, veins will differ from arteries because since they carry blood under less pressure, they have valves in order to prevent backflow of blood. Veins are also different because their walls are going to be thinner. And because their walls are thinner, they're able to have a larger inner space to carry more blood. So their lumen, the actual inner space where blood is carried, is larger than it would be in arteries. This is a generic overview of the cardiovascular system. The blood gets pumped out here through the left ventricle, through the aorta, down to the body tissues. Once that blood gets used, blood is sent back through venules and veins to the right side of the heart. It's pumped to the lungs to pick up oxygen, and then back to the heart to be pumped out again. So the whole point of the cardiovascular system is to take blood, pump it to the lungs to pick up oxygen, take it back to the heart, then pump it out to the rest of the body. Alright, we'll start with the heart. It's about the size of your fist, maybe a little bit larger than your fist, located just left of center of your chest. The base of the heart is proximal to your head, while the apex will be distal, be a little bit further away. Although the heart is one single organ, it's easier to think of this as two separate pumps, the left-hand side and the right-hand side. And these pumps will work together and function as one organ. The right side of the heart will collect blood that's returning from the body, and it will pump that blood to the lungs to get oxygen. The left-hand side of the heart collects this blood as it comes back from the lungs, so it can pump it out to the rest of the body. So the blood on the right-hand side of the heart has deoxygenated blood, and the blood on the left-hand side of the heart has blood with oxygen. There are 4 chambers that are found in the heart. The 2 chambers on the left-hand side are separated from the 2 chambers on the right by a wall called the septum. Now, the wall between the upper chambers, the smaller chambers, the atria, atrium is singular, so you have a right atrium and a left atrium, but collectively they're called the atria, for plural. The wall that separates those two is called the interatrial septum. And the wall between the ventricles, the 2 lower chambers, the pumping chambers, is called the interventricular septum. And the key thing to remember when you look at a picture like this, something that comes up fairly often in anatomy. When you're looking at images like this, it's based on the perspective of the patient, not you, the observer. All this may be the right-hand side of the picture that you're looking at. This is the patient's left-hand side. This is their left ventricle, their left atrium. the left pulmonary veins, and so on. So don't focus on where it is in the image. It's about the patient, not you, the observer. For the top chambers, the atrium, the right atrium, left atrium. The two bottom chambers, the actual pumping chambers of the heart, the right ventricle, left ventricle. Now the right atrium is the collecting chamber where all blood will return to the heart, no matter where it comes from. It doesn't matter if it's coming from the top of your head or the bottom of your feet. All blood will enter the heart through this chamber, and they'll return to the heart through one of two vessels, either the superior vena cava or inferior vena cava. So going back to this image, so blood returning back to the heart from, say, your chest and your neck and your head will come down here via the superior vena cava. Remember, superior means above. And the blood coming back to the heart from, say, your chest and then downward will enter the heart through the inferior vena cava. All this blood is dumped into the right atrium. Now the blood will travel from the right atrium through a one-way valve called the tricuspid valve, and this will go into the right ventricle. Once that right ventricle is filled with blood, the chamber will contract. The tricuspid valve is there to prevent backflow of blood. So as the right ventricle is contracting, it pumps blood through the pulmonary valve into the pulmonary arteries to go away from the heart to go to the lungs. The right pulmonary artery will go to the right lung, and the left pulmonary artery will go to the left lung, where these vessels will get smaller and smaller and smaller, ending up in the tiny air sacs where gas exchange actually occurs, called the alveoli. Blood is then returned to the heart via the right and left pulmonary veins. So even though it's a vein, it's going back to the heart with oxygenated blood. So recapping the right-hand side, all blood will enter the right atrium here, either through the superior or inferior vena cava. Blood will pass through the tricuspid valve here into the right ventricle. When that chamber contracts, it will pump blood through the pulmonary valve, going to the left and right pulmonary arteries. It will pick up oxygen. It will come back through the right and left pulmonary veins and enter the left-hand side of the heart through the left atrium. Once blood enters the left atrium, it will travel through another valve called the mitral valve or the bicuspid valve. Either term is fine. It will travel into the left ventricle. The left ventricular pressure will increase as it fills, and as it contracts, it will slam shut the mitral valve, and the blood is ejected out through the aortic valve into the ascending aorta, which is the largest artery in our body. Then after the blood travels through the aorta, it will branch off from there, getting smaller and smaller, going through various parts of the body. Okay, so going back to this original image we had, so blood enters the right atrium, travels through the tricuspid valve, enters the right ventricle, is pumped through the pulmonary valve, they go to the pulmonary arteries, they get oxygen, here and here. It will come back through the pulmonary veins, left and right, enter the left atrium. It will pass through the bicuspid or the mitral valve, entering the main pumping chamber of your heart, the left ventricle. When that blood is pumped out, it will go through the aortic valve, which is right here, through the aorta, and from here, all blood vessels will branch off of here at some point. Now, blood is ejected from the heart through a contraction phase called systole. After the blood is ejected from the ventricles, the heart enters a resting period called diastole. So during the diastole, chambers will fill with blood. So that's why your blood pressure readings are the systolic pressure over your diastolic pressure. The force of the contraction of the heart versus the force of it relaxing and filling the blood. Now, some key things to remember. In a normal functioning heart and a normal healthy person, the atria do the same job at the same time, and the ventricles do the same job at the same time. So the whole process of the conduction system and the heartbeat must be in a very coordinated manner for all this stuff to work properly. So the heart has to contract in a very particular way, in a very particular order, to make sure all the blood is pumped out efficiently. Now, the contraction of the heart will actually begin at the point of the heart, the apex of the heart, and will travel upward. Now, there are valves that we've talked about, the pulmonary, aortic, mitral, and tricuspid valve, that are there to prevent backflow of blood in any direction. Blood should always be going forward in this process. You don't want blood to be going backwards. And these valves are open and closed based on the amount of pressure. And as the ventricle contracts, it will slam open certain valves, and other valves will be slammed shut due to the drop of pressure. The atrial walls will be a little bit thinner than ventricular walls because the ventricles are the pumping chambers, so they will need more force to pump blood out either to the lungs or to the rest of the body. So the atrial walls don't need to be as strong or as thick. So you'll have higher pressures generated in the ventricles in order to contract and to move. The walls of the left ventricle are going to be thicker than the walls of the right ventricle because the right ventricle is only pumping blood from the heart to the lungs. It doesn't really have to go all that far. But the left ventricle is pumping blood throughout the entire body. There will be a portion of the newly oxygenated blood that leaves the heart that gets diverted from the aorta into the right and left coronary arteries. So it's important to remember that the heart is a muscle, and muscle needs blood. So the heart needs to get some source of blood for its own cells, for its own tissue, in order for it to work and function properly. So that's what the coronary arteries do. They supply the heart muscle with blood itself directly. So these arteries will continuously divide into smaller and smaller branches, forming interconnections. And these interconnections are needed to supply the heart with a very rich supply of blood. Now, regular aerobic exercise increases the density of these blood vessels, and the numbers of these interconnections also increase. So the more you exercise, the more interconnections are made, which means the faster the heart muscle can be supplied with blood. Now, the right coronary artery will provide blood for the right ventricle and the posterior portion of the interventricular septum, and also the inferior parts of the heart. The left coronary artery will provide blood to the left lateral and anterior walls of the left ventricle, and also portions of the right ventricle and interventricular septum. So here are images. Of course, this major vessel here is the largest artery we have, the aorta. And coming off of this aorta down here, you have the right coronary artery here with its branches, and also the left coronary artery here with its branches. Next we'll talk about pathology connection, some problems with cardiac muscle and cardiac vasculature. The first one, right-sided heart failure, cor pulmonale. This is a condition in which the right-hand side of the heart can't move blood efficiently. Now, this develops because the heart muscles are chronically working harder than normal. So the muscles on the right-hand side of the heart become too large, which means they can't pump blood effectively. So the heart has to work harder to catch up on the volume of blood that it needs. Now, the heart may also have to work harder in other cases, such as polycythemia, which is a thickened amount of blood due to the higher levels of red blood cells. Some other conditions, if you have constricted pulmonary vessels, this will cause the right-hand side of the heart to work harder than it should. And both situations could develop in association with certain lung disorders or lung diseases. Now, cor pulmonale occurs in about 85% of all patients with COPD, chronic obstructive pulmonary disease. The vessels going to the lungs are being obstructed and or damaged, so this is affecting how well the right-hand side of the heart is able to function. Some pathophysiology. The healthy left-hand side of the heart will continue to pump blood normally because it isn't affected, but the unhealthy right-hand side of the heart can't keep up because it is so inefficient. So what happens here is the blood will back up into the systemic veins. So this will cause an enlarged spleen, enlarged liver, swollen ankles, feet, hands, distended veins in the neck. Because the cardiovascular system is one continuous system. If blood isn't going forward, it has to go somewhere. So that means it's going to go backwards. So that means it could be cause swelling in the lungs or in other organs such as the liver and the spleen, or in the feet and ankles and so on. So the blood has to go somewhere. See, heart failure, this is formally called congestive heart failure. This is a general condition where the heart can't move blood efficiently, and this can affect either the left or the right hand side. Now, the pumping action of the heart can't overcome the resistance in the blood vessels. So what happens here is the blood will back up into the veins. So the increased pressure in the veins allows fluid to leak from the vessels into tissues. Possible causes here involve damage to the muscle after a heart attack, which results in inefficient pumping of the muscle itself. All right, again, in right-sided heart failure, the left side is pumping normally, as it should, but the right side has become so inefficient it can't keep up. So the blood will back up into the systemic veins, which will cause fluid to leak into the body's tissues. So this will lead to an enlarged liver, an enlarged spleen, carotid arteries will bulge out, swelling of the ankles and feet, and also the hands. In left-sided heart failure, the right side is pumping normally, but the left side can't keep up. So the blood will back up into the pulmonary veins into the lungs. So the fluid will leak out into the vessels and into the lung tissue, resulting in pulmonary edema or swelling. Now, symptoms of this could be shortness of breath, a wet-sounding cough, and hypoxia. The heart failure can be treated with medications, including agents that will increase rate and the force of heart contraction, and also diuretics that will rid your body of excess fluid. All right, an example of left-sided and right-sided congestive heart failure. Right-sided, and the blood gets backed up into the systemic vessels, so you get an enlargement of the spleen and the liver, distended neck veins here. And for left-sided heart failure, the blood will get backed up into the pulmonary vessels, into the lungs. You get a pleural effusion and also pulmonary edema. Myocardial infarction, more commonly called a heart attack. This condition is caused by inadequate or absent blood flow to an area of the heart muscle. Ischemia, this is an inadequate flow of blood. Now, this does not damage the heart permanently, but can result in chest pain called angina pectoris. Angina means pain, and pectoris is reference to the pectoral muscle. Now, this can be treated with nitroglycerin, which will dilate the coronary blood vessels to improve blood flow. Now, an infarct is tissue damage and death that results from a completely blocked blood flow. So a myocardial infarction is actually the tissue damage and death, the infarction of myocardial tissue, the actual heart muscle itself. Now, this could result from a blood clot in coronary blood vessels, coronary thrombosis, and this can cause permanent damage to the heart if tissue death occurs because the cardiac muscle can't repair itself. And once the tissue is permanently damaged, it doesn't get any better. Once it's damaged, it's damaged. Some signs and symptoms of a MI: chest pains or heaviness in the chest, radiating pain down the left shoulder, the arm, neck, and jaw, nausea, heartburn, generalized weakness. Also, you'll have dizziness or anxiety, a clammy, sweaty feeling, and also the shortness of breath. Now, getting prompt medical treatment and diagnosis can be difficult because some patients experience little or no pain at all. It's called a silent myocardial infarction or silent MI. Now, some patients, especially women, exhibit non-traditional signs and symptoms like jaw pain. So you may not associate that right away with a heart issue. Now, patients may misattribute symptoms to other medical conditions, indigestion, heartburn, pulled muscles. You may not immediately think of a heart attack. If a heart attack is suspected, it's important that you call 911 immediately and also take aspirin. Aspirin is a mild anticoagulant, which will help keep the blood flow around the heart, which will minimize damage. See, medical diagnosis may include measurement of various enzymes and proteins found in the blood, certain substances that are released in the bloodstream when cardiac muscles die. So those are good indicators that there has been an infarction somewhere. Some measurements that are used to diagnose: CKMB is a special kind of creatine kinase that's found within the heart muscle cells. This enzyme can be detected in blood within 2 to 6 hours after an MI. LDH lactate dehydrogenase. This will increase in blood approximately 12 hours after a heart attack. Troponin 1 and 2. This will increase in blood approximately 5 to 6 hours after an MI. And some substances will remain elevated in the blood for several days even after the event, after the MI. So monitoring blood levels of these substances can be important in diagnosing an MI. Arteriosclerosis is the thickening or the hardening of the inner layer of the arteries. Arterio is reference to arteries. Sclerosis means to thicken. This occurs in most people as we get older. Now, this can cause some vessels to become less flexible and even brittle, increasing the risk of a rupture or likelihood of high blood pressure. Another condition that is closely related to arteriosclerosis, atherosclerosis. This is a potentially life-threatening condition. It's where you have fatty deposits called plaques that are building up on the inner lining of the blood vessels. And these plaques are mostly made up of cholesterol, which can partially or even completely obstruct blood flow. And any blood vessel is susceptible to this condition, but some are more susceptible than others. The ones that are more likely for this to occur, the aorta, the coronary arteries, and the cerebral arteries. Some risk factors for atherosclerosis: heredity, diabetes, poor lifestyle, poor diet. All those are contributing factors to atherosclerosis. Here's an image of how that would look. If we just zoom in right here on these coronary arteries, as the plaques develop, they will cling to this inner lining of the blood vessel, obstructing the amount of blood that can flow down. Now, there are some treatments that can improve the blood flow, the cardiac muscle, such as coronary angioplasty. This is a procedure where a catheter that has a balloon on the end of its tip is threaded up to the area where there are plaques, and when it's in the right position, the balloon is inflated, basically squishing the plaque away and increasing blood flow. So basically the balloon is crushing the plaque to dissolve it and getting out of the way of the vessel wall. You can also have a intracoronary stent placement. Stents are wire devices that actually hold open blood vessels after angioplasty, and this can prevent reocclusion of the blood vessel. Another treatment that can be used, CABG, coronary artery bypass graft. This is a surgical procedure where healthy blood vessels from another part of the patient's body are used to replace the damaged or the clogged coronary arteries. Here's an example of how the balloon angioplasty would work. They have the catheter is threaded into the affected coronary artery here. The balloon is put in position here, right around where the plaques are. The balloon is inflated. They're pushing the plaques against the vessel walls to flatten them out. Then the balloon is deflated, and the catheter is removed, and the blood flow should improve. Alright, in this illustration we have placement of a intracoronary stent. What we have is the stent is fitted over a balloon tipped catheter. It's fed into the vessel where it's needed. The stent is positioned in place right at the blockage, and then it is expanded with the balloon being inflated. The balloon is deflated and then removed, and then the stent will stay in place, holding open the obstructed area. Now, cardiac muscle is what's called autorhythmic, which means it can contract without nerve impulses or hormones telling it to contract. Now, uncontrolled individual contractions would not be efficient, so there has to be specialized cardiac cells that create and distribute the electrical current that causes a controlled and direct contraction of the heart. So nodal cells, or your pacemaker cells, are specialized cells that not only create the electrical impulse, but create impulses at a regular interval. So these nodal cells are connected with each other and to a connecting network all throughout the heart. Now, nodal cells are divided into two groups, the sinoatrial node and the atrioventricular node. The SA node, or sinoatrial node, this is your body's natural pacemaker. It's located in the wall of the right atrium, right near the entrance of the superior vena cava. This will generate an electrical impulse at approximately 70 to 80 impulses per minute. The AV node, or atrioventricular node, is located right where the atria and the ventricles meet. That's why it's called an AV node. And this will generate electrical impulses around 40 to 60 times per minute. So what happens in the electrical pathway, your natural pacemaker, the SA node, will send an impulse to the AV node before the AV node can send its signal. However, the AV node acts as a backup if the sinoatrial node fails to fire, which will result in a slower heartbeat because the AV node fires at a slower rate compared to the SA node. It's an illustration of that conduction system. And the SA node right here, that sends an impulse to the AV node here. And then from there, the impulse will continue on through other structures. The AV bundle also known as the bundle of His. The bundle branches, left and right. Those will further break down into what are called Purkinje fibers. So all this is done in a very coordinated manner. Now, of course, the heart rate is not always 70 to 80 beats per minute. While the SA node sets the heart rate at rest, other factors can change your heart rate, such as the autonomic nervous system, whether it be parasympathetic or sympathetic nervous system. All of these have direct connections to the SA node and the AV node, as well as your heart wall. So, for example, the sympathetic division can release neurotransmitters that increase heart rate and also the force of contraction. So whenever you're in a stressful situation where you need epinephrine, you need your heart to beat faster and with more force. This is why your heart races after you're in an emergency situation. And the opposite of that, the parasympathetic division can release neurotransmitters via the vagus nerve to decrease pulse and to decrease the rate or the force of contraction. Also, body temperature, hormones, ions, all can alter your heart rate. And of course, epinephrine, which is a key component of the sympathetic nervous system, is what will cause your heart to race, not only in force, but also in rate. Now, a fever can increase the heart rate due to the increased metabolic rate. The altered levels of sodium or potassium or calcium can also alter the heart activity. Low levels of potassium can lead to a weak heartbeat, while high calcium levels can prolong heart muscle contractions to the point where the heart can stop beating. Other factors, age, sex, exercise can all impact the heart rate. The normal female heart rate is between 72 to 80 beats per minute, while for males, the normal rate is between 64 and 72 beats per minute. And the movement of these electrical impulses in the heart muscle are done by specialized conducting cells. So once the electrical impulse is generated at your pacemaker, the SA node, that impulse will travel to the AV node. There will be a slight delay there, allowing the atria to fill with blood before the contraction moves forward. Once that charge hits the AV node, it travels through the AV bundle, also called a bundle of His. The impulse will travel down the right and left bundle branches in the interventricular septum, and these branches will spread across the inner surface of both ventricles. And the impulse will go into what are called Purkinje fibers that carry the impulse to contractile muscle cells of the ventricle. And the contraction will begin at the apex of the heart and act as a wave of contractions smoothly up the ventricle, squeezing out all the blood possible. Here's an illustration of a pretty standard ECG tracing. And these little bumps and these spikes and these valleys all mean something very particular. And knowing how they should look can give you an indication of what's going wrong when you're looking at an EKG. Alright, this first initial bump here is called the P wave. Now the P wave will correspond to the contraction of the atria. Alright, the next combination of valleys and spikes is called QRS. That's this region here. This will correspond to the ventricles contracting. The next little hill after that is called the T wave. Now this represents the preparations for the next set of complexes. So basically the ventricles becoming repolarized. Alright, now move on to a pathology connection. Talk about electrical disturbances, in particular arrhythmias. Now arrhythmias or dysrhythmias, these are heartbeats with an abnormal rhythm, often due to some abnormality within the heart's electrical conducting system. There are many different types of dysrhythmias. The first one, flutter. This is coordinated but extremely rapid contraction of the heart chamber. Now flutters can reach 300 contractions per minute. Fibrillation, a rapid uncoordinated contraction of cardiac muscle cells. Heart block is a condition where electrical signaling between the atria and ventricles is delayed or sometimes is completely blocked off. So the results are the atria and the ventricles are contracting out of sync with one another. And the way you would treat dysrhythmias, the first one, the implant of a pacemaker, is a surgical device where it will electrically stimulate the heart, triggering the contraction. And this pacemaker has two leads, a dual lead that's implanted. Both the atrial contractions and the ventricular contractions are coordinated. Now some pacemakers will trigger every heartbeat, depending on how much damage there is to that patient's conduction system. Others may only work when the patient's heart doesn't send its own electrical signals. Some people are fully pacemaker dependent. Some people only need it from time to time. Defibrillation is a device that applies electric current to all the cardiac muscle all at once. In the cases of a life-threatening arrhythmia, this can be used to basically jumpstart the heart back to the normal rhythm. These are basically the paddles that you put on the apex of the heart and on the sternum of the patient. And so when you yell "it's clear," and then you hit the power, and then their chest will extend forward as it gets filled with this electrical impulse. And the point of this isn't to start the heart. The point is to stop the heart so it can reset and go back to a normal rhythm. Here's an illustration of a standard pacemaker implant right here, just below the collarbone or subclavian region here. It'll be connected to the heart through various leads here. Sometimes they're up by the collarbone, sometimes they're in the lower abdomen. Okay, now we'll move on to our next major topic for this chapter in the cardiovascular system. We'll talk about blood. Now, blood is a fluid form of connective tissue, and the amount of blood that you have will depend on your overall body size and your sex. Normally, you should have about 4 to 6 liters of blood, and it will equal roughly 9% of your overall total body weight. And the blood has 3 main functions: transportation, regulation, and protection. Blood will transport oxygen from the lungs and nutrients from the digestive system and fat cells, and then hormones from endocrine glands to approximately 75 trillion cells in the body. On the way back to the heart, the blood will transport carbon dioxide and other waste products to the kidneys, lungs, and other organs for removal. The blood also plays a key role in maintaining the variety of different levels within the body, so you can maintain a homeostasis, monitoring pH levels, electrolyte levels, and so on. Also helps to regulate body temperature by absorbing heat generated by skeletal muscles and spreading it throughout the rest of the body, or by releasing it through the skin so it can cool down. Now, the blood can either take in or give up more fluid in order to help regulate the fluid balance within the body. The blood also helps us protect us from invasion and infection from pathogens and their toxins. And there are specialized white blood cells and special proteins called antibodies that help to prevent infection. Now, the major components of blood are the liquid part and the solid part. The liquid part is called the plasma, and the solid part are the cells, or also known as the formed elements. The plasma is a yellowish, straw-colored liquid that's about 55% of the blood's volume. And of that plasma, 90% of that is water, and the other 10% includes salts and oxygen, hormones, nutrients, and other regulatory substances. Now, plasma proteins are an important group of dissolved substances that include albumin, which helps in monitoring the amount of water within the blood. Another plasma protein, fibrinogen, is a substance that is needed for blood clotting. Another plasma protein are the globulins. These include antibodies, which will help provide for immunity and will fight infections. Some of the formed elements, these are all the cells that you'll find within the blood, such as the red blood cells, for example, or erythrocytes. The prefix eryth is Latin for red, so these are literally red cells. You also have the multiple forms of the white blood cells, or also known as leukocytes. And white blood cells include basophils, eosinophils, lymphocytes, monocytes, and neutrophils. And the last kind of formed elements you'll find in the blood are the platelets, also known as thrombocytes. Here's the overall composition of blood. If you were to take a blood sample here, place it in this vial, and spin it through a centrifuge, the formed elements, because they are solid, the solid cells would sink down to the bottom, and then the plasma, which is liquid, would be the top layer. And of course, this chart has it broken down into plasma versus formed elements, and what's found in those layers and what their major functions are, such as the plasma proteins, the various white blood cells, the red blood cells, platelets. We'll start with the red blood cells. Now, the red blood cells are created by red bone marrow, erythropoiesis. And this has to happen because mature red blood cells do not have a nucleus, so they can't divide on their own. When they are immature, they do, but as they get older, they lose organelles, they lose the nucleus. They have a shape very similar to a donut that's filled in. It is flat and round and biconcave. It caves in on both sides of the cell. And the red blood cells have 2 main functions. To aid with the iron-containing red pigment called hemoglobin, and also to transport oxygen. And on a lesser scale, to help transport carbon dioxide from cells to the lungs so it can be exhaled out. Their chief function is to carry oxygen to cells. The leukocytes, these are the guardians from invasion and infection. There are several types divided into 2 main categories. Each originate from different areas. The first group, the polymorphonuclear granulocytes. These will originate from the red bone marrow. Then you have the mononuclear granulocytes that originate from lymphoid and myeloid tissue. Here they all are on one image. These are all under the umbrella of leukocytes. These are all white blood cells. The granulocytes here, neutrophils, eosinophils, basophils. And then the agranulocytes are the monocytes and lymphocytes. First we'll talk about the polymorphonuclear granulocytes, the neutrophils, eosinophils, and basophils. And they're called granulocytes because their cytoplasm looks very grainy, like bits of sand. That's why they're called granulocytes. And the other two types, the two other white blood cells that fall into agranulocytes, don't have that appearance. They don't have those granules within their cytoplasm. But these first three that we'll talk about do have that feature. Alright, we start with the neutrophils. These are the most aggressive in cases where bacteria attempt to destroy some of your tissue. They have a key role in phagocytosis. This is a process in which neutrophils will surround and then ingest a foreign invader, and by doing so it will destroy that invader. These neutrophils will hunt it down, surround it, engulf it, and then destroy it because of some of the digestive enzymes that are found in lysosomes. Okay, as an infection occurs, the body will produce higher than normal amounts of neutrophils. So a high neutrophil count indicates that there's an infection somewhere in your body. Eosinophils, these are used to combat parasitic infections and a variety of different irritants that can lead to allergies. Basophils, these are believed to be involved with allergic reactions and inflammation. They secrete a chemical called heparin, which is an anticoagulant. And they also release histamines. So if you have allergies to ragweed or pollen or grasses, it's because of these cells, these basophils. It's also the reason why you take antihistamines, to neutralize the effect of these basophils. Alright, move on to the agranulocytes, the mononuclear agranulocytes. And again, they're called that because their cytoplasm does not have these bits of sand, these granules. They are agranulocytes, without granulocytes. The first one, the monocytes, they're found in higher numbers than normal when there's a chronic infection. They destroy invaders through phagocytosis. And even though they take longer to arrive at the scene of an infection than neutrophils do, because their numbers are greater, they destroy more bacteria. And the other kind of agranulocyte are the lymphocytes. These will protect us from infection by using a process that involves antibodies. They either inhibit invaders directly or indirectly. See, thrombocytes, also known as the platelets in the blood, these are the smallest formed elements and are responsible for allowing your blood to clot. And these aren't really full cells. These are basically fragments of a much larger parent cell. So these are not considered to be whole cells. So whenever you have an injury, platelets will stick together at the site of injury, and as these platelets collect and get larger and larger and larger, they end up forming a plug, a platelet plug that blocks the injury site. And after that, they release serotonin, which will cause smooth muscle constriction, which will decrease blood flow. So this is all a part of the clotting process. A person that needs a blood transfusion can't just randomly get blood from a random donor. You can't just grab a bag of blood off of a shelf at a blood bank and give it to someone. There has to be certain precautions that are used to make sure that you are getting the right kind of blood. That's due because of what's found on the surface of red blood cells and how they would react to antibodies in the recipient person. Alright, foreign antigens not originally found in the body are called non-self antigens because they are not from you, they are from another person. And then self antigens exist on the cell membrane of every cell in your body. This is how your body determines what is you and what is not you, what is a foreign tissue. So what happens is antibodies will react with antigens that they deem to be foreign or not from you, and as this happens, they will stick together in small clumps. This is called agglutination. Now, when cells are in this form, in this agglutination, they can't function, and they eventually will be torn apart to the point where they are destroyed. So obviously, they can't work beyond that. So in addition to this, you have a series of events called the antigen-antibody reaction, which is the entire basis of the immune response. While there are over 50 different types of antigens, the main focus is on A, B, and then Rh antigens. Type A blood is very common. It's about 41% of all American population as this type. And when we say type A, that represents a specific type of antigen that's found on the surface of red blood cells. This is what determines what your blood type is what The special compound is found as an identifier on your red blood cells. Since this person is born with type A blood, it won't make any antibodies to fight it. So there are no anti-A antibodies, but there will be anti-B antibodies. Type B red blood cells will possess type B self-antigens. So for this person, obviously it won't make anti-B antibodies because it won't attack its own blood, but it will have anti-A antibodies. So if a person with type B blood is given type A blood, the anti-A antibodies would attack the donated red blood cells and destroy them because they see it as something foreign. Anything that your body sees as foreign, it will attack and it will attempt to destroy. So the antibodies will cause agglutination, which can result in some serious damage and can be fatal if not corrected. Now type AB blood has both A and B self-antigens. So it will have neither anti-A or anti-B antibodies. And because of this, people who have AB blood are seen as the universal recipients. They can receive blood from anyone because they don't see any other blood type as being foreign. For people with type O blood, their red blood cells contain no A or B antigens, but its plasma will contain both anti-A and anti-B antibodies. So people who are type O are called the universal donors because they can give blood to anyone because there's no conflict with anyone that they could potentially give blood to. Alright, here's a summary of not only surface antigens but the different kinds of antibodies that are found and what would happen. So, for example, type A blood will have surface antigen A but anti-B antibodies. Type B blood, surface antigen B on the red blood cells and anti-A antibodies. Type AB blood will have both surface antigens A and B, but no anti-A or anti-B antibodies at all. And type O, no surface antigens, but have both anti-A and anti-B antibodies. So here, this is a summary of what's in this graphic up here. This chart here at the bottom will represent what would happen if a certain recipient of a certain blood type received blood from another blood type. So for example, type O blood, if they receive blood from a donor that is type O, nothing happens, which is what you want. If they receive blood from a donor that is type A, you'll get agglutination. If they receive blood from a donor with type B, agglutination. AB, agglutination. Or people with type O blood can only receive blood from type O people. People with blood type A, they can receive blood from type O or type A and have no problems. But B and AB will cause agglutination. Those with type B blood can receive blood from donors that are type O or B, but A and AB will cause agglutination. And those that are type AB can receive blood from anyone. So these are the universal recipients. And then type O blood is a universal donor. They can give to anybody. Now, there are special blood antigens that were first found in the blood of the rhesus monkey. So this is called the Rh factor, due to the first letters of the word rhesus. So it's the Rh factor. Now, if someone has this surface antigen, they're called Rh positive. If someone doesn't have it, they're called Rh negative. This is where you get type O positive, O negative, A positive, A negative. That's where those positive and negative terms are referencing. And most people will have this factor. So it's found in about 85% of whites and about 88% of African American population in the United States. So as a result, people are going to be A positive or negative, B positive or negative, AB positive or negative, or O positive or negative, all due to the Rh factor. Rh factor can lead to some serious problems, and in particular when a woman is pregnant. If the father is Rh positive and the mother is Rh negative, the baby will inherit the father's Rh factor. So baby will be Rh positive, but with mom being Rh negative, the mother's body sees the fetal blood and the fetus as something foreign, and it will attempt to destroy it. So the mother will start to develop antibodies against this incompatible Rh factor. Now, usually the first pregnancy is not a problem, usually. This is one of a number of reasons why prenatal care is such an important factor. If this is discovered, the pregnant woman will be put on a drug called Rogam, and this will help to prevent this. Because what would happen is, if she were to become pregnant again, there would already be enough antibodies ready to attack the second pregnancy, the second fetus. And this can cause hemolytic disease of the newborn, which can terminate the pregnancy. All right, now move on to pathology connection. We'll talk about assorted blood conditions. Polycythemia is an increased number of red blood cells. There are two types here, primary and secondary. Secondary polycythemia is a chronic low levels of oxygen will cause the body to produce more erythrocytes to transport more oxygen. Remember, the function of red blood cells is to transport oxygen. So if you have a chronic situation where you have low levels of oxygen, the body has to respond to that by making more red blood cells to catch up or to maintain the levels of oxygen that your cells need. And then primary polycythemia can be due to bone marrow cancer. Anemia is a decreased number of red blood cells or an abnormal or deficient amount of hemoglobin. Some possible causes: bone marrow dysfunction, low levels of iron, or improper formation of the red blood cells. Some common symptoms: having a pale skin tone or nail beds in fingers and toes and the mucous membranes, muscle weakness or fatigue, shortness of breath, chest pains. Sickle cell anemia. This is an inherited condition in which the red blood cells and hemoglobin can't form properly. Instead of being flat and biconcave in shape, they form a sickle, which is like a crescent shape. And because of this, they can't carry as much oxygen. They tend to get stuck within blood vessels, and they are easy to rupture. So as these cells are destroyed, the body is stimulated to produce more red blood cells, resulting in immature cells due to a high production rate. And these patients will suffer from increased clotting and the impaired ability to carry oxygen because the ruptured cells basically clog up blood vessels. And then when you have high numbers of red blood cells, this will cause the blood to become more viscous and thickened. Leukemia is a condition where you have a higher than normal amounts of white blood cells, and this is usually in response to bone marrow cancer. Now, even though you're producing more white blood cells, these are often going to be immature white blood cells and also will be ineffective. Leukocytosis is also characterized by a high white blood cell count, but usually due to an infection. Leukopenia, this is a low white blood cell count. This could be due to a chronic infection or the result of drugs. All right, blood vessels. After the blood leaves the heart, it will branch into vessels called arteries. Now, arteries will get smaller and smaller and smaller, and at their smallest, they're called arterioles. Now, arterioles will feed into capillaries that form capillary beds within the body's tissues. This is where oxygen and nutrients will infuse into cells and also will pick up carbon dioxide and waste products to be removed. Our blood will continue the journey from capillaries to small blood vessels called venules. Venules will combine to form veins, and these veins will eventually merge into the vena cava and take the blood back to the heart. For most blood vessels, the walls are composed of 3 distinct layers, often called tunics or coats. The tunica interna, the most internal, tunica media, the middle layer, and tunica externa, the outermost, or the most external. The tunica interna is composed of a loose layer of tissue that's made up of squamous epithelial cells. Now, this compacting of this epithelial cells makes a very smooth surface so blood can easily pass through. The tunica media is a thicker middle layer. It's composed mainly of smooth muscle and elastic tissue and collagen. By contracting and relaxing these muscles, this layer actually controls the diameter of the vessel to meet certain needs of the body at any given time. Now, sometimes you need the vessel to be larger to allow more blood flow. Sometimes you need the vessel to be smaller to slow down blood flow. It is the sympathetic nervous system that determines the body's need and whether or not the blood vessel needs to constrict or dilate. If it constricts, it will have a smaller diameter, which will increase blood pressure. And if it dilates, it will have a larger diameter, which will lower blood pressure. And both of these will play a role with controlling the amount of blood supply going through that vessel. And the outermost layer, the tunica externa, this is composed of mostly fibrous tissue, and its job is to provide vessel support and protection. Here are the arteries and veins side by side, and the different layers of the vessels. So the tunica externa, near the outermost layer, the media, the middle tunic or the middle coat, then the tunica interna, the innermost layer. They have arteries that will branch into smaller vessels called arterioles, which will join and form capillaries. They'll lead on to small veins or venules, then onto regular veins. And here are images of some major arteries and some major veins. and the name will indicate where it's found. Deep femoral artery, found near the femur, left and right subclavian, underneath the collarbone, and so on. Now, the differences in the structures of these blood vessels will vary depending on their job. Now, arteries will carry blood under much higher pressure, so they need to be much stronger compared to veins, because veins carry blood under very low pressure. So for arteries, they will have a much thicker wall, so they're able to handle blood moving under such higher pressure. And veins, because they don't carry blood under high pressure, don't have a need for a thicker wall like this. And the larger arteries will contain complete sheets of elastic tissue called elastic laminae that will help the vessel expand and it can recoil back to normal as blood is pumped under such high pressure. See, another difference structurally between arteries and veins, the lumen, or the actual inner space where the blood is contained, in veins is larger, because since they don't have a need for the thicker wall, they make up for it by having a much larger lumen. And the arteries, because they have that thick middle wall, the space left to carry blood, it will be smaller, so their lumen is smaller. Veins will also have valves to prevent backflow of blood. Because the blood is under such low pressure in veins, it's very easy for that to pool if it's not helped back to the heart. So valves help prevent the backflow of blood. So this is where you need physical activities such as the contracting of skeletal muscles. Skeletal muscles will basically squeeze the blood in the veins back to the heart, or milk the blood back to the heart. If you don't do this, say if you're sitting at attention, and if you don't move for too long, blood will pool in your feet and in your lower legs, and if that's the case, the blood will be getting to your brain, and then you will pass out. So even slight skeletal movements will help push the blood back to the heart to go through the cardiac cycle again. Alright, now I'll move on to capillaries. These only have one layer, the tunica interna, which has a diameter of only 0.008 millimeters, 0.008 of a millimeter. So this is slightly larger than the diameter of one red blood cell. And because you have such a small space, this allows for easy movement of oxygen and nutrients through the wall, while carbon dioxide and waste can move back into the blood to be removed. Now, each cell will require approximately 250 milliliters of oxygen, while producing 200 milliliters of carbon dioxide every minute while the body is at rest. The capillary beds are composed of two different types of blood vessels. You have the vascular shunt, which is the main road connecting arteriole to venule. Then you have what are called the true capillaries. These are what will make up actual exchanges within tissue cells. True capillaries are considered the on and off ramps going to and from the vascular shunts. And just before you get to the capillaries, you'll find precapillary sphincters that are composed of smooth muscle. And you can think of these as like a toll booth, either allowing or stopping blood from going through to the vessel as they open or as they constrict. Blood that is allowed through will travel through the true capillaries and into the cells. Otherwise, the blood is redirected toward the vascular shunt. For example, the image here on top, the precapillary sphincters here are open, so blood is allowed to flow through, then onto the postcapillary venule. If the precapillary sphincters are closed, they will not go through the capillary beds, but travel directly through the vascular shunt. Now, the cardiovascular system is a closed and pressurized system. So if a break or a leak in the system can't be stopped, you are going to lose an awful lot of blood. Now, there are some substances that are in the blood that help to plug these leaks, plug these breaks. And this process is called hemostasis, the actual stoppage of blood. It's done through a series of events. The process of hemostasis is the clotting process. Now, when the inner wall of a blood vessel gets damaged, the underlying collagen fibers become exposed. And as the platelets are floating by it and within the blood, they stick to the damaged ends of these collagen fibers. And these platelets will attach to each other and get larger and larger and larger, and creates what's called a platelet plug. Now, these platelets will secrete serotonin, which will cause the blood vessels to spasm, basically constricting to lessen the amount of blood that could be lost. So within about 15 seconds, the blood clotting or coagulation will begin. So with the help of calcium and 11 different plasma proteins, a chain reaction will start. One of those clotting proteins, prothrombin, is produced by the liver with the help of vitamin K, and it gets converted into thrombin. Thrombin will transform fibrinogen, which is a plasma protein dissolved in the blood, into a solid hair-like fiber called fibrin. Very tough, very strong, very sticky fiber. Now this fibrin will form almost like a fishing net or like a spider's web that will patch at the site of the injury, snagging more and more blood vessels as they float by. So within 3 to 6 minutes, a clot is created. So once this clot is formed, it begins to retract and pull the edges of the damaged tissue back toward each other so it can regenerate any necessary epithelial cells to begin the permanent repair over a certain amount of time. And eventually that clot will be dissolved because the clot is no longer needed at that point. Okay, so here we have the injury of this person's knee. You see the vessel wall being torn here. So you have platelets that are, as they travel in the blood, as they travel by this site, they will stick these tattered edges, and they will start to stick to each other, forming a platelet plug. Then you have the clotting factors that are found throughout the blood. So you have calcium playing a role with vitamin K and prothrombin. All those act together to form or to convert prothrombin into thrombin. That will convert fibrinogen into fibrin, which forms basically a really sticky and strong spider web that catches all other blood cells as they travel by the area. And this area will get more and more clogged, forming the blood clot. Alright, now we'll move on to a pathology connection with clotting, and we'll talk about hemophilia. Hemophilia is a general term for an inherited blood condition that impairs the clotting of blood. Thrombocytopenia is a condition where there are fewer than normal circulating platelets in the body. So if the count is low enough, even a routine act such as moving can cause a person to bleed. And the causes of this could be a liver dysfunction, a decreased level in vitamin K, radiation exposure, or even bone marrow cancer. Alright, now we'll talk about the formation of unwanted clots, such as the formation of a thrombus. Rough surface of the inner lining of the blood vessel may allow platelets to stick to the inner wall of this vessel, and it's called a thrombus. So a thrombus is a clot that forms abnormally. So a thrombus in the coronary artery can partially or even completely totally block the blood flow to a portion of the heart, causing a heart attack. And the area of the myocardium that is affected will determine the severity of the attack. Okay, so the formation of a thrombus is dangerous enough, but what happens when a piece of that clot breaks off and starts to travel throughout the body? That's when it's called an embolus. So a thrombus is just a clot that forms abnormally, but when it starts to break away and starts to travel in other parts of the body, then it's called an embolism. An embolus will eventually get stuck in a small vessel, which could partially or completely block the vessel and the blood flow further downstream. And remember, the circulatory system is a closed circuit, so eventually this will reach the heart, it will reach the brain, it will reach the lungs. So these can be very, very dangerous. A cerebral embolus could cause a stroke. A pulmonary embolus could affect oxygenation of your blood. Risk factors for unwanted clots: slow blood flow, such as people who are bedridden, people who sit for long periods of time in a plane or a bus or a car, women who smoke and who use oral contraceptives are at a higher risk than other women, and people who are on certain types of chemotherapy drugs are also at an increased risk. Some treatments and preventions from an abnormal clot formation: aspirin and heparin can be taken to decrease clot formation. Streptokinase is known as a clot buster that can break up an existing clot. Alright, now we'll move on to issues with the systemic blood vessels. First one, aneurysm. This is a localized weakened area of a blood vessel wall. Now, this could be caused by a disease or injury or even a congenital defect. Often there are no symptoms, but when an aneurysm continues to expand, it can rupture, causing a massive hemorrhage. If this happens in a major artery, a person can bleed out and die within just a matter of minutes. This is why an aortic aneurysm is such a serious condition. And surgical intervention can remedy the situation if it's found early enough, but often there are no symptoms. PVD, peripheral vascular disease, is characterized by plaques that are built up in the arteries of the legs. These plaques will interfere with blood flow to the legs, which can cause leg cramping with exertion. And the treatments for this will include cleaning out the clogged vessels of the plaques. See peripheral ischemia and gangrene. If these plaques affect smaller arteries, blood flow to the toes and to the feet may become inadequate. So this can lead to a difficulty healing, or gangrene infection, or tissue necrosis, or tissue death. So at this point, surgical amputation of the affected area may be necessary. If the tissue is already dead, it can't be fixed. Your best bet is just to eliminate it so it doesn't impact other tissue that's living. Alright, now I'll move into some common diseases of the cardiovascular system. The first one, pericarditis, or cardiac tamponade, or tamponade. The etiology is an inflammatory process that produces pericardial effusion, trauma, rupture of the heart or the aorta into the pericardium. Some signs and symptoms: pain is possible, a tightness or fullness within the chest, a loss of consciousness if it's an extreme example. Some diagnostic tests: patient exam, personal history, radiological studies, and for treatments, medical treatments such as removal of the offending fluid if there's no rapid improvement. The endocarditis, the etiology here, inflammatory process or an infection. Some signs and symptoms: anorexia, back pain, fevers, murmurs, night sweats, weight loss. Diagnostic tests would include an echocardiogram, and treatment would be antibiotics. This is the inflammation of the endocardium, the innermost lining of the heart. See, heart failure, formerly called congestive heart failure. This can be right or left-sided. The etiology: pulmonary hypertension, high blood pressure, polycythemia, increased workload on the heart, myocardial infarction, vascular disease, a variety of cardiac infections. All these can lead to right or left-hand sided heart failure. Signs and symptoms: they will differ depending on what side of the heart is impacted. For the right-hand side heart failure, you have peripheral edema, you have enlarged spleen, enlarged liver, some distended veins in the neck. If it's the left-hand side heart failure, you'll have pulmonary edema, and you have a shortness of breath. Some diagnostic tests: patient history, physical exams, radiological studies. Some treatments: you want to treat the causative condition. You may want to treat with oxygen or certain medications to improve heart function, diuretics, and decreasing the workload on the heart. Murmur, etiology for these: this is a result of blood leaking backward due to a faulty heart valve or a narrowed valve opening. Remember, blood should always be going forward throughout the circuit. When blood goes backwards, that's when you develop a murmur. Some signs and symptoms: abnormal sound in the blood flow of the heart. Diagnostic test: auscultation, and of course with ultrasonic confirmation. And treatments: a correction of the condition that is creating the abnormal murmur. Many murmurs are not that big a deal. They just need to be monitored over time. But some murmurs can be a very serious problem and need to be dealt with. Prolapse, in particular with a valve. Etiology: this is due to various connective tissue disorders and sometimes coronary artery disease. Some signs and symptoms: this could be possibly asymptomatic. You may have a murmur, there may be fatigue, palpitations, dyspnea, an increased chance for clot development. Diagnostic tests for prolapse of a valve: auscultation, echocardiograph, radiologic studies, cardiac catheterizations, and stress testing. For treatments, medications, and possible valve reconstruction or valve replacement if it's a severe case. Stenosis within the valve. Etiology here could be due to a genetic origin, or just through the normal aging process, or through rheumatic fever. Some signs and symptoms: murmurs, possible fatigue, chest pain, pulmonary edema, syncope. See some diagnostic tests: auscultation, cardiac catheterizations, echocardiograms, radiologic studies, stress tests. Some treatments for this: a possible valve replacement or even some medications. Alright, in this image we have an illustration of the multi-system effects of heart failure in general. This covers anything from neurologic impacts to cardiovascular, pulmonary, genitourinary, integumentary, and so on. Such as heart failure can lead to confusion, impaired memory, shortness of breath, or dry cough, the respiratory acidosis, the abdominal distension. So it's always key to remember, whenever you're studying any body system, that nothing works in a vacuum. If one thing gets messed with, it's going to impact several other body systems. So if the heart starts to fail, it's going to impact countless other body systems in the body. See, aneurysm, etiology here: some people have a genetic predisposition to aneurysms, trauma, hypertension, atherosclerosis, tertiary syphilis, which is not terribly common, signs and symptoms, pain, differences in the right and left femoral pulses. The differences will indicate that there's either a blockage or a weakage or a weak point somewhere. Diagnostic test, radiologic studies, and treatments, observation, and if this is a severe or if it's a very threatening condition, you'll need surgical repair. Angina, etiology is the ischemia of the myocardium due to poor blood flow or blood perfusion of the heart and tissue. And some signs and symptoms, chest pain, chest discomfort. Diagnostic test, patient history, blood work to rule out an acute heart attack or acute MI. Treatments include oxygen or nitroglycerin, procedures that would reopen the cardiac vessels, such as perfusion. Arteriosclerosis, etiology, this literally means the hardening of the arteries. Could be due to age, could be due to minerals being deposited on the inner walls of the arteries, or other degenerative conditions. Signs and symptoms, there are often no signs or no symptoms for many, many years, sometimes even decades. But then all of a sudden there's an increased blood pressure, there's angina, there's a TIA, transient ischemic accidents. Diagnostic test, angiograms, blood test, MRIs, stress testing, and ultrasound imaging. And for treatments, improving the diet, exercise, stopping smoking, reducing stress, balloon angioplasty, and if needed, a surgical repair. Atherosclerosis is a peripheral vascular disease, or etiology. This is the most common form of arteriosclerosis. It's caused by buildup of yellow fat-like substances called plaques. This is caused by poor diet or smoking, not exercising, stress. Could be hereditary in nature also. Signs and symptoms. Again, it's like with arteriosclerosis. There are often no signs for years or even decades. And then you get an increase in blood pressure. You get angina, TIAs. Some diagnostic tests, angiograms, blood tests, stress testing, MRIs, ultrasounds. And then for treatments, improved diet, improved exercise, stopping smoking, reducing stress, balloon angioplasty, and then also surgical repair. Now these last two terms, arteriosclerosis and atherosclerosis, people tend to use it interchangeably, but they do mean two separate things. Arteriosclerosis is when the vessels become, or arteries become thickened or become stiff. Atherosclerosis is a very specific type of arteriosclerosis, where you get the buildup of plaques and cholesterols and fats. So they are obviously very related, but there is a difference between the two. The next one, CAD, coronary artery disease. The etiology here, insufficient blood flow to the heart tissue, usually due to atherosclerosis, but maybe due to clots within the coronary arteries. Some signs and symptoms. The classic symptom is angina, but it could include nausea, clammy hands, sweating and fainting, pulmonary edema, and various locations of pain. These are diagnostic tests. Often no signs for many, many years. Then you'll get an increased blood pressure, angina, TIAs. Treatments for CAD is like the other heart conditions we talked about, reducing stress, improving your diet, exercise, stopping smoking, balloon angioplasty, and surgical repair if needed. The embolism, or a traveling blood clot. The etiology, thrombophlebitis, venous stasis, inflammation, smoking, hypercoagulation disorders, some contraceptives, varicose veins, foreign particles, tumors, traumas, and even pregnancy can lead to the development of embolisms. Some signs and symptoms. This will depend on the location and the size and the number of emboli that are involved. And for the diagnostic testing, a perfusion scan would be used. Treatments for embolism, a clot-busting medication, preventative measures that could include anticoagulant medications, physical activity, treating the thrombophlebitis directly, stopping smoking, and the surgical removal. Next one, high blood pressure or hypertension. Etiology could be due to a diet that's high in fat or high in salt. Age, and the older you get, the risk gets higher and higher. Smoking, stress, heredity, and the decreasing flexibility of the blood vessels. Some signs and symptoms. Often it's not noticed until after you have a heart attack or after you have a stroke, but can be easily determined with a blood pressure cuff. The increased mass of the left ventricle usually is a sign of hypertension. And there's a ringing in your ears, That's usually a sign of hypertension. Being very agitated, being short-tempered, and a general feeling of not feeling right. And some diagnostic tests, a standard blood pressure cuff measurement. Treatments, changing your diet, losing weight, exercising more, relaxation techniques, decreasing the amount of alcohol that you drink, stopping smoking, certain medications like diuretics, because that will increase blood flow to your peripheral structures, and this will lessen the workload on the heart itself. All right, next one, myocardial infarction, or MI, or more commonly known as a heart attack. Etiology, conditions or situations that may lead to decreased blood flow to heart tissue, which could lead to ischemia or necrosis. Signs and symptoms, indigestion, a heavy or a crushing type of discomfort or pain in the center of the chest, radiating pain in the left shoulder, arm or jaw, or even in the shoulder blades, anxiety, inability to sleep, nausea, vomiting, sweating. Some diagnostic tests, ECG, physical exam, and also a patient history. And for treatments, CPR, oxygen, cardiac drugs, cardioversion or a pacemaker if necessary, other forms of surgery also. All right, next one, PVD, peripheral vascular disease. Etiology, the atherosclerosis, where you have the plaques building up with a progressive narrowing of the lumen of the vessel. Diabetes can also be a causative factor, a PVD. Some signs and symptoms, cramping, pain, decreased blood flow to the affected areas, a decreased ability to heal properly, being very sensitive to cold temperatures, developing gangrene, and developing necrosis. Some diagnostic tests, a patient's history, physical exam, vascular studies. Treatments for PVD, you want to treat the underlying cause, which could mean surgical intervention, such as cleaning out the plaques that are causing the obstruction, or inserting a graft on the healthy artery. Varicose veins, etiology, these are swollen and distended blood veins normally found superficially in the legs, but can also be found in the rectal area also. That's what a hemorrhoid is, technically. It can be caused by excessive blood pressure. Some other contributing factors include heredity, obesity, sitting or standing still for very long periods of time, physical exertion, age, and also pregnancy. Some signs and symptoms. This will vary severity to no signs at all to having some very extreme symptoms. So this may include night cramps, a dull aching pain, pain in the feet, ankles, itching, pain, fatigue, bleeding from hemorrhoids. Diagnostic tests, say physical examination. Treatments will include weight loss, physical movement to prevent the venous stasis, such as daily walking, support hose, and elevation of legs, surgery, laser usage, sclerotherapy, which include saline injections, stool softeners, and surgery if needed for hemorrhoids also. Bradycardia, etiology, this is caused by heart damage or an increased vagal stimulation, certain drugs, and in some cases it may be idiopathic, where there's no known cause to the bradycardia. Signs and symptoms, bradycardia is a slower than normal heart rate, so usually less than 60 beats per minute, or less than 50 beats per minute during sleep, and being very lethargic. Diagnostic test, the standard ECG, and a treatment would include the surgical implanting of a pacemaker. Fibrillation, whether it be atrial or ventricular fibrillation, AFib or VFib, as some people commonly call this. Etiology here, an acute MI, imbalances with your electrolytes, hypertrophy, and electrical shock. Signs and symptoms, if it's a ventricular fibrillation, there'll be a decrease in blood flow. Could be a collapse with possible impending cardiac arrest. And if it's atrial fibrillation, there'll be palpitations. Diagnostic test, ECG for both AFib and VFib. Treatments would include CPR, defibrillation, and medications. Flutters, etiology for these, this is an intrinsic heart disease, or could be caused by extrinsic influences like alcoholism. Some signs and symptoms, an unstable rhythm that can revert to a sinus rhythm or to fibrillation. Diagnostic test, ECG. And for treatments, this would include either cardioversion or medications. The heart block, etiology for this could be caused by scar tissue in the heart muscle that will affect the smooth flow of the electrical impulse throughout the heart muscle. Signs and symptoms, irregular beats, palpitations, slower pulse. Diagnostic test, ECG. And for treatments, especially in a severe case, you would need a pacemaker. The palpitations, etiology, structural abnormalities, irritation or inflammation, or even trauma to the heart tissue. Drugs, stress, various diseases of other body systems could lead to palpitations. Signs and symptoms, an irregular or an abnormal heart rhythm. Diagnostic test that's used, ECG. And for treatments, you will need to correct the causative agents of the palpitation or by using medications also. The premature contraction or extrasystole. Etiology, in healthy people may be due to caffeine or nicotine or stress. It's often common in patients with underlying heart disease. Some signs and symptoms, irregular rhythm. The way you would check for this would be an ECG. And for the treatments, you need to eliminate the causative agent, such as stopping smoking, lowering your caffeine intake, and so on. The tachycardia, etiology here, the initial response to a decrease in oxygen in tissues could be caused by a result of stress or physical demands. Could be caused by heart disease. Could be congenital or could be idiopathic. So tachycardia is a rapid heart rate. So tachy means rapid or very fast. So some signs and symptoms, a more rapid than normal heart rate, usually more than 100 beats per minute, in the absence of stimulation or exercise. So even when you're just sitting still in a chair, your heart may just start to race 100 beats per minute, like it would if you were exercising, but you are sitting still. The diagnostic test, ECG. Some treatments, medications. Certain types may respond to carotid massage, cardioversion, and also vagal maneuvers. The anemia. Etiology for anemia could include cancers or radiation or chemotherapy that alters the bone marrow, or having too little amino acids, or folic acid, or iron, or vitamins B6 or B12. Also be caused by the production of defective red blood cells, or having an excessive blood loss. Some common signs and symptoms of anemia: fatigue, muscle weakness, hypoxia, shortness of breath, palpitations, angina. And the first one listed here, pallor, is an unhealthy pale appearance. These are diagnostic tests for anemia, blood tests, personal history, physical exam. Some treatments: you will treat the condition that's creating the anemia, stopping the bleeding, replacing the red blood cells, fixing any dietary deficiencies. Erythrocytopenia, etiology, this is a decrease in red blood cell production, or an increase in red blood cell lysis or rupturing. Can be caused by hemorrhaging, dietary insufficiencies, Hodgkin's disease, multiple myeloma, leukemia, or lupus, or Addison's, having a subacute endocarditis pregnancy, and also drugs. Signs and symptoms: a decreased number of blood cells for a given volume of blood. In a normal, healthy person, there should be a set percentage of red blood cells in a normal blood sample. It should be around 45% of a sample. So when that number is too high or too low, that indicates that something is wrong. So other signs: headaches, fatigue, shortness of breath, pallor, and this can be something that is life-threatening. Some diagnostic tests, blood tests, obviously. The treatments: you need to treat the causative agent, medications, and if need be, a blood transfusion. Erythrocytosis, etiology here, polycythemia, either vera or secondary. Could be caused by severe diarrhea, or pulmonary fibrosis, or dehydration, acute poisoning, high altitude living, and certain drugs, such as gentamicin. Some signs and symptoms: an increased number of red blood cells for a given volume of blood, say having a reddened skin tone, having a increase in blood pressure, increased cardiac workload, having bloodshot eyes, having a increased risk of clots. These are diagnostic tests: patient history, blood test, physical exam, as in radiological studies. And treatments will be obviously to treat and correct the causative condition. Hemophilia, etiology here, this is an inherited bleeding disorder, but although 1/3 of these cases exhibit no familial history of hemophilia, but it is an inherited trait. Signs and symptoms: bleeding episodes, often into joint and muscle areas. Pain accompanies these bleeding episodes. Internal bleeding is always a possibility. Diagnostic tests, blood tests, to measure for clotting factors. Treatments: infusions of clotting factor to replace the ones that just aren't there or not being made properly. The development of synthetic clotting factors is also a consideration. Hyperlipidemia, etiology here, is an increasing problem in which there's an excessive amount of fatty substances in the blood, including triglycerides, cholesterol, and fatty acids. You're having a higher number of lipids in your blood that should normally be there. Some signs and symptoms: having high levels of your LDL, the low density lipoproteins. This is the bad cholesterol. And then having lower than expected levels of your HDL, or high density lipoproteins. Having fat deposits in arteries, hypertension, and also coronary artery disease. Some diagnostic tests: blood work, patient history, physical exam. And for treatments, changes in diet, increasing your activity levels, reducing stress, taking statin medications, and also niacin. Leukemia, etiology, could be possibly due to inherited factors, could be caused by radiation, could also be caused by viral causes. Some signs and symptoms: headaches, sore throat, fevers, fatigue, swollen lymph nodes, bleeding of the GI tract or the mucosal membranes of the mouth, bone and joint pain, enlarged lymph nodes or spleen or liver, repeat infections, and also anemia. Diagnostic test: physical exam, blood work to check for the counts for your white blood cells, and also radiological exams. For treatments: chemotherapy, bone marrow transplant if necessary. Leukocytopenia, etiology, is caused by a viral infection or chronic infections, or a bone marrow depression, diabetes or alcoholism, acute leukemia, chemotherapy treatments, radiation treatments. Some signs here: having a lower than normal white blood cell count for a given volume of blood, and also having a decreased immunity. Diagnostic test: blood test to check for white blood cell counts. And for treatments, treating the causative agent, and also some medications. Leukocytosis, etiology here, caused by infections or leukemia, malignancy, especially in the GI tract or in the bone or in the liver, hemorrhaging, traumas, tissue necrosis, certain drugs, certain toxins. Some signs and symptoms: having an increase in number of white blood cells for a given volume of blood. Some diagnostic tests: blood test, obviously they check for the counts for the white blood cells. And for treatments, treating the causative agent. Polycythemia, etiology here, is a primary result of myeloid leukemia, often secondary to chronic hypoxia, high altitude living, congenital heart disease, could be a result of liver cancer or renal disease. Alright, some signs and symptoms: having a higher than normal number of circulating red blood cells in relation to a normal blood volume, but this shouldn't be confused with having an increased red blood cell concentration due to decrease in plasma volume, such as in a burn patient. So you're not talking about concentration, you're talking about actual numbers of red blood cells in relation to a normal sample. Some diagnostic tests: blood tests, bone marrow biopsies also. And for treatments, the elimination of the causative agent. Thrombocytopenia, etiology, having a less than normal level of platelets, usually due to leukemia or bone marrow aplasia, hypersplenism, certain drugs, or even following a viral infection. Some signs and symptoms: spontaneous bleeding into tissue, including the GI tract or the urinary tract. Diagnostic tests: blood test, patient history. For treatments, treating the causative agent, and if necessary, transfusions for platelets. Alright, we'll end this chapter with our pharmacology corner. Some treatments for myocardial infarction, or MI. The first one, nitroglycerin. This will dilate the coronary arteries to increase the blood flow to the cardiac muscle. Thrombolytics. These are used to dissolve any clots that are obstructing blood flow. Anticoagulants. This will prevent future clot formation, such as heparin or Coumadin. Oxygen. This will decrease the workload of the heart. And some surgical interventions that could be used for treatments: balloon catheterization and CABG, coronary artery bypass grafts. Some blood pressure medications. These are used to decrease the blood pressure. They could work in several different ways, and some possible mechanisms of these drugs include decreasing the blood volume, such as diuretics. You could vasodilate the peripheral vessels, such as ACE inhibitors. And ACE inhibitors are angiotensin converting enzyme inhibitors, slowing down the heart rate itself by using beta blockers or calcium channel blockers. Drugs that will help lower cholesterol. By decreasing your levels of cholesterol, you will decrease and prevent the clogging of blood vessels. Some examples of this include Zocor and Lipitor. Medications for treatment of shock. Shock is characterized by extremely low blood pressure and can interfere with tissue perfusion. Some medications for shock. These are used to stimulate the heart to increase the rate and the force of the contractions, such as dopamine and epinephrine. If the blood loss is contributing to the low blood pressure, then blood replacement or an IV fluids will be needed. Alright, that brings us to the end of Chapter 12, the cardiovascular system. We will continue our video series with Chapter number 13.